Welcome back to DermDocs, everyone. Today we have Dr. Doris Day speaking about the latest advances in cosmetic dermatology. Dr. Day was just recently named one of the top 5 dermatologists in America for 2022. Please enjoy the podcast, everyone. And if you haven't already, please leave us a 5-star review, rate, subscribe, and follow us. Hi, Dr. Day. Welcome back to DermDocs. It's so nice to have you on the podcast again.
So great to be on with you. Thanks for having me back.
Of course. And it's amazing. Breaking news. You're one of the top 5 cosmetic dermatologists in America. Congratulations.
Thank you. That was such an honor and a surprise. That was nice to see.
Absolutely. So obviously you're sought after not only by patients for your clinical expertise, but also by the media to weigh in on trending topics in cosmetic dermatology. How do you cultivate such a respected position in this industry? And what responsibilities come with having such a wide reach?
Oh, that's such a good question. And it kind of always takes me by surprise. One of the things that I've learned is that, and it's from having studied philosophy, is that you have to keep in perspective what your goals are. And my goal is never to be famous or to have any of those accolades. My goal is always to try my best to be great at what I do. And I think it helps to never take anything on that level to heart too much. So it always feels good to hear nice things and to have people say nice things about you and appreciate the work you do, especially on the media side. But at the same time, it's when I'm in the room with the patient that my care of that patient is all that matters to me. And when I'm not taking care of my patients, it's studying dermatology, studying aesthetics, cosmetic dermatology, teaching, just remembering that my focus is on the why I'm doing it, not the comments around it. So I love hearing it, but it sort of has its place, and I never forget why I'm doing it. I do it because I love it. I think it's an honor and a privilege to be a physician, and I'm always a student of the art and science of medicine and aesthetic dermatology.
Absolutely. And your actions have clearly proven that you're one of the top dermatologists. And you're also an author too. So yes. Do you enjoy the writing process, and do you think you'll publish more books in the future?
Writing was my first career. I was a medical reporter, medical journalist before I was a doctor, and I was an English major in college, studied literature and philosophy. So that study and that side of medicine and science is really interesting to me. I love telling stories. I love translating what I hear on the scientific side to the layperson side, because there's something really exciting about learning. And when I know something and I'm able to share that and help somebody else learn it as well, it feels so good. And so my goal is always to try to help those around me not just feel better, but also be better. And that comes through understanding why they see what they see, why they're going through what they're going through, and why we're doing what we're doing. So that education side and the writing side is really important to help convey that. And my radio show is the same. I've had a show on Dr. Radio for 15 years. It's a 2-hour talk radio show that I host, and I do it twice a month. And I'm talking for 2 hours and telling stories and taking calls. So that's a good exercise for me, because I get what the public perception is about all the things we're doing. And also I get to translate what I know of the science, whether it's around new treatments, like there's a new treatment for alopecia, for hair loss, autoimmune hair loss now, talking about, is that medicine safe? How is it used? Who is it good for? All of that stuff, being able to give people proper information is really important to me. And it doesn't come easy. I have to say that writing, I don't think I'm a natural at it. It's work, but if I write and rewrite enough, 2 things happen. One is it works and it does what I need it to do, which is convey that information. And 2 is that I learn so much, because when I have to distill something down and get it into words that make sense and come together, you have to know 10 times more and be able to get the essence of it out without being too scientific in your language and without kind of going over people's head, but also not dumbing it down so that they're missing out on important information. And that learning process for me is very, very helpful. I learn and grow from it. So it goes both ways. But I think writing for me is more of a compulsion than anything else. And I'm working on my next book, and it's on the skin biome. And I'm writing it with a PhD, with a colleague, and I'm learning so much about all the little organisms that live in the skin, how important they are, and how we can cultivate and nurture them to help our skin heal itself, age backwards, and even treat lots of rashes, eczema, psoriasis, and even cancer. So there's a lot that our skin can do. And if we treat it right and feed it right, topically, the skin will look and behave so much better. And all of these lasers and devices that we have, when we combine it with biome supportive treatments that go along at the time of treatment, we can have a lot less redness and a lot better outcome with fewer treatments. So this is an emerging science. And unfortunately, a lot of people who treat the gut or pay attention to the gut microbiome are trying to just directly put that to the skin. So you're seeing a lot of pre and pro and postbiotics that are good for the gut being used on the skin when it's two different systems, two different ecosystems, and they need two different approaches.
Well, that will definitely be life-changing for a lot of people, because I know plenty of people who have redness in their skin, and they're like, how do I fix this? They just have to put, makeup over it. It's very frustrating sometimes. So
yeah,
that sounds like a life-changing thing. And we are excited to see your new book then.
It's work, and hopefully in another year. It takes time.
Great. Yes, of course. So this August, LivDerm is honored to welcome you back to Miami Beach for the 20th anniversary of South Beach Symposium. Can't believe it's 20 years. Tell us a bit about the history of the event and what aspects you look forward to each year.
The South Beach meeting is really a must go to meeting, because it covers such a broad array of medical and aesthetic dermatology. And every year it brings top physicians who are able to talk about the latest science, the latest breakthroughs, and the latest techniques. And there's a lot of hands-on as well. So it's really an all-encompassing meeting in a beautiful location where it's fun. There's a lot of networking, and there's so much learning that goes on. So this is a meeting that I've participated in for many, many, many years. And every year I look forward to it. I look forward to participating on so many different levels, to speaking, to help with the planning and the coordinating. And it's just a meeting that when you talk to anyone who's been there, they're always like, yeah, that's a meeting. You see the same people there every year who either are speaking or who are participating in the meeting because they learned so much. So they look forward to coming back every year.
That's great. So you don't want to miss it.
Correct.
And you'll be delivering sessions on topics in both aesthetic and medical dermatology.
Correct.
Do some topics such as female sexual rejuvenation actually encompass both disciplines?
Oh, for sure. One of the things I love about dermatology is that everything is on some levels aesthetic, because people care about how they look. And when they see something that doesn't look right on their skin or feel right, they want to know medically that it's okay, but they also want it to look better. So to me, they're not two separate fields on many levels. And I always see the connection between both. So when it comes to female rejuvenation that can happen due to hormonal changes or so many other reasons, whether it's medical or just time, there is a lot that we can do. And women want to have confidence, and it's not vanity. It's actually, I think, in a way, proof of life, that people want to feel beautiful in every way and feel that what they feel and what they want to see matches. And that's something that we can help them with. So it's never a judgment, and it's never making someone feel like if they do or don't do something, there's something wrong with them. And it's just a matter of what can be done, what's the best way to do it, and what can you expect on the other side. So it's all connected, and a lot of it has to do with the assessment, understanding why we're doing what we're doing and what we can get out of it. But that's one area where I think we don't pay enough attention to what women need or want.
Makes total sense. And what would you recommend to a patient who specifically wants that certain kind of a treatment? Just what steps could they possibly initially take?
I always think it's good to start by seeing your OBGYN to make sure that you have your pap smear and you are otherwise healthy, and then understand the next level of are you around menopause? Is there a hormonal issue? So it's building up on the medical side to see exactly what's going on. And once we have that sorted out, then knowing what devices there are. And there's a lot of devices from erbium lasers to radio frequency and other devices that can help both internally and externally to help with lubrication, to help with the appearance of the genital region, and also to improve the sexual experience overall. So we can affect multiple levels, but it should be done and assessed by sometimes a multidisciplinary team that includes gynecologists, but also most certainly dermatologists. And as dermatologists, we've treated STDs or sexually transmitted diseases. We've treated rashes and problems in the genital area for centuries. And it's actually a core part of what we do as dermatologists. So this is not out of our purview. Some dermatologists focus on it more than others. And I think with the advent of devices that can help improve the lubrication and a lot of the aesthetics of the area as well, it's kind of come up again in dermatology, but this is organic to what we do.
Thank you so much for sharing those tips. I think that'll be very helpful for our patients listening. So as you know, South Beach Symposium is extending our reach this October by hosting a conference in California. As an East Coaster, what differences do you think attendees at SBS West Coast Derm can expect from education focused on the aesthetic needs of West Coast clientele?
There is definitely a difference between East and West Coast approaches to aesthetics. And I think it's nice to have a regional approach in a regional meeting. Sometimes it's just hard to travel to the East Coast, and having access to such a great meeting that's more local is convenient as well. So some of it is just that it's more education, and it may be the same on the East and West Coast, but it's just more of a West Coast audience and a West Coast set of physicians who are teaching or speaking at the meeting. But if I could travel to the West Coast, if I had time on my calendar, I would go from the East Coast to the West Coast to hear what's being done and what they have to say. I think there are definitely differences. And as an East Coaster, I might have my biases about what they do on the West Coast that I might do differently here. But it's all good, and it's nice to have regional sort of meetings that are convenient for people who want to stay local.
Absolutely. Well, thank you for all your insight. Is there anything else you'd like to share with our audience today, Dr. Day?
It's been a pleasure being on with you, and always a pleasure working and presenting and participating in the South Beach meeting. And if you're on the fence about going, I would encourage you to sign up and to look for all of us who are speaking, to network together. We're always here, happy to help each other. I think there's room for everybody at the top. And the more of us that are successful, the happier I am. And I know many of us are, that we can share our knowledge to help our patients and accelerate our specialty.
Thank you very much. And it's always a pleasure.
Thank you. I appreciate it. Thank you.
Thank you.